record. Good morning. Here we are again for another Sunday show. This time the subject is prostate cancer, and asking me all the questions, your questions, is Larry Brooks, our chairman. How are you, Larry?
I'm really, really good, especially after we won 4-0 yesterday. It's put me in a great frame of mind.
Yes, for the men watching, we're talking about Watford. We're not doing very well this season, but we did very well yesterday. All right, this is a recording for the Sunday show, which will go out in a couple of weeks' time, and we're going to talk about prostate cancer. Larry's got a whole list of questions, so what I'm going to try and do is give anybody listening some information and tips that can improve their odds of personal survival. That's what it's all about. So, Larry, off you go. I don't even know the order of the questions. Go.
I've got some great questions here. The first one, I keep hearing that sugar feeds cancer. So is that what's feeding my prostate cancer? So that's from Richard Jones.
Yes and no. What happens is what's really feeding your prostate cancer is something called glutamate. And glutamate's like the reserve tank of fuel. So when you've got a car, you always have a little bit in the reserve tank. And glutamate's made from glutamine, which is an amino acid, and it's in protein like meats in particular, but it's also in vegetables and so on. And so glutamine converts into glutamate, and also excess sugar converts into glutamate, and a little bit comes from folic acid. But glutamate is the prime feeder of prostate cancer.
Well, okay. This is from Mark Roberts, who's a regular on the shows. In the show where you interview Mark Gittins, you said that prostate cancer is a completely different cancer. Why is that?
Well, I don't know why it is, but I do know it is very different cancer. Well, look, let's start us chaps. You know, if we're going to get prostate cancer, we've got a 76% chance of getting prostate cancer when we get to 70. As I said, number one, it's fed by glutamate, not sugar. Number two, I don't know a drug. I just don't know a drug that's going to kill prostate cancer off. If I get it, if the men listening to this were to talk to their wife and their wife gets breast cancer or ovarian, out comes the Taxol and the carboplatin. They've got drugs that can kill it off. We poor chaps, we don't have anything that can kill it off, not when it's in our prostate. The other thing is it's got a very high level of cancer stem cells. And number one is pancreatic cancer, and number two equal are brain tumors, which are also fed on glutamate, and prostate cancer. So it's a very different cancer, because when you've got lots of cancer stem cells, you can knock it back all you want, but you've got to deal with the stem cells, or they're going to grow as well. So you know, they cause recurrence is what I would say about a stem cell. And so that's the kind of picture of prostate cancer. It's just a very different cancer. All the drugs available are there to cut my testosterone, which as a chap, I'm not too sure I want done, but never mind.
Have you heard of Charles Myers in the USA? Asked Tony DeAngelis.
That I have, lad. Right, Charles Myers, very interesting. Actually, one of my patients, Lionel, he's probably going to be listening to this, is going to remember it all too well. He came to me, I won't name him any more than that. He came to me and he'd had prostate cancer. It had gone to his bones and lymph, I think. And he'd gone off to find a man in America called Charles Myers. And Charles Myers is a famous scientist in that he's invented 6 drugs. And when he got to a certain age, he went and got prostate cancer. So what he did was he knew that some of his drugs actually that he invented could actually affect his prostate cancer. And he ended up using off-label drugs to actually beat his own prostate cancer. And Lionel knew about this, went off to America to see Charles Myers. His nickname is Snuffy. And literally got cured and had about 6 or 7 years off. I think I'm going to get the story right. He'll probably write to me afterwards. And what happened was he then got it back. And I think it went to his bones and lymph again. And I said to him, what did Myers do? And he said, well, he gave me something called LDN, which is a low dose naltrexone, which is an immune booster, off-label drug, old drug. And secondly, he gave me dutasteride. Dutasteride is a well-known drug for cutting your estrogen. And Charles Myers is still, he formed the prostate cancer forum in America, but he's stopped all that now because he's retired. But he still does interviews and he still does YouTubes and he's still talking about dutasteride, although they sort of cut him off just before he says it quite often on YouTube. I'll probably get cut off for that when but dutasteride is an anti-estrogen.
Wow. And what role does estrogen play in prostate cancer?
All right. Well, this is a huge thing, really, because there are several factors that you need to know about in prostate cancer. But one of them is it's always called highly inflammatory prostate cancer. So when I read PubMed and things like this, it's always called highly inflammatory prostate cancer. I never see it's highly inflammatory breast cancer or highly inflammatory brain tumors, but it is with prostate cancer. And the reason for this is that you always get a swollen prostate first. You always find it hard to wee and things like this. And so the swollen prostate is the start point, and it can be benign, obviously it doesn't have to be cancerous. But there are two major reasons you can get a swollen prostate. Number one is infection, which we'll probably talk about later on. But number two is estrogen. So what actually happened was back in about 2002, there was a research from Australia about using finasteride or dutasteride or sugar pills with men with a swollen prostate. And it all went swimmingly well, and their prostates got smaller if they were on finasteride or dutasteride. So estrogen's clearly a player. And then people on the finasteride group got lots more prostate cancer than they should have had. So everybody stopped it after about a year and a half. But nothing really for the dutasteride group. Then in about 2004 at Concord in Sydney, they showed you had to have estrogen present with testosterone. So now we bring testosterone into the picture. And you needed to have both. And then in about 2006, Dr. Timothy Thompson at MD Anderson, he explained it all. What he said was, us chaps, when we are young, we get lots of testosterone in our bodies. And when we get to 50, the testosterone that kept us lean and mean, unfortunately, starts to go into decline. So we are less lean and less mean. We start to get fat stores around our middles, for example, and our fat stores. If you're a woman and had breast cancer, you would know only too well that your fat stores make estradiol and estrogen, a very nasty estrogen that can cause chaos inside your cells in your body. So estrogen actually is a player. And what Myers was, Timothy Thompson was saying was that estrogen almost multiplies up testosterone, of course, something called DHT, and that's the real culprit. Now, I don't know 100% whether it is the real culprit, but there's lots of evidence about this. This is what I find slightly bizarre, because, for example, is this really all about testosterone? So weightlifters pump testosterone. They take testosterone pills. So what would you think if this was all about testosterone? Then weightlifters, bodybuilders would get more prostate cancer. Actually, they get less. And I was talking to Rob Thomas about this on the show, and he said, actually, we're finding, Chris, that people with low testosterone are getting more prostate cancer than high testosterone. So you're looking at a picture here where there's something over here called estrogen, but everybody's focused on testosterone. And I don't fully know why. It's the kind of unanswered question. But you can have three sorts of estrogen. You can have human estrogen, you can have chemical estrogen, you can have plant estrogen. And we know, plant estrogen's your friends. And Rob Thomas, for example, was using broccoli juice for breakfast, broccoli soup for lunchtime. And I challenged him on this. I said, well, everybody knows broccoli contains indole 3-carbinol. It's an anti-estrogen. Right. And he kind of ducked a little bit, I saw in the show. I hope he doesn't mind me saying that. But then we've also got chemical estrogens. And I did a research report about 10 years ago. And 13 known chemicals, herbicides and pesticides, are linked to prostate cancer. Guess what? When I checked them all out, they're all estrogen mimics. And then you get human estrogen. So I've covered human estrogen. It's estradiol and things like that. Then you get chemical estrogens. Then you get plant estrogens. Actually, plant estrogens are your friends. That's the thing you've always got to remember. So soy and red clover and indole-3 carbinol are your friends. They're not your enemies. So is resveratrol and so on. But estrogen is really important. So you can make estrogen yourself. And the one thing I would say, it's called aromatization, and it's a kind of best kept secret. If you eat grapefruit or grapefruit juice or very big oranges, you will have more aromatization. You'll literally make more estrogen in your body. I don't think that's a very clever idea. Is that a good enough answer?
Yeah, just to clarify, there's a question linked here from Martin Mayo. So should I be cutting my estrogen or my testosterone?
$64,000 question. Okay. If you've just got prostate cancer or just been diagnosed, they will almost, and your PSA is low, they will almost certainly put you on watch and wait. If that was me, I'd cut my estrogen. I'd do everything in my power to cut my estrogen, and I would bring it down. So we know, for example, that women, when they get estrogen-driven cancer, they get given aromatase inhibitors. So aromatase enzymes make their estradiol, and they're given inhibitors for that, and letrozole and anastrozole. Well, you can get something called myomin. It was invented by an oncologist in Chicago, and it cuts your estrogen. You can take indole-3 carbinol. You can do green juices. You can eat a rainbow diet with lots of greens and beans in it. And you can take indole-3, but the best thing to take is melatonin. Now, it's very hard to get melatonin in Britain above about 2 milligrams. So if you've got a friend in America or Canada, write to them, ring them up and get them to send you some, because melatonin regulates your estrogen in your body, human estrogen. So what would I do? I think as a bloke, I'd cut my estrogen. I think it's almost an unnecessary question in a way. I'd cut my estrogen first, because if Timothy Thompson's right, you've got these two things playing, and, you know, and Concord in Sydney, you've got these two things causing your prostate cancer. So I even suggest people have heard of black cumin seed and black cumin seed oil. Well, black cumin seed is an adaptogen. And what it does in us chaps, it puts our testosterone up and brings our estrogen down, and it regulates our cortisol, our stress hormone. And so we use black cumin seed oil if people aren't on any drugs. But the second they've got you on a testosterone drug, a testosterone lowering drug, I daren't use it, because it's going to fight against the drug you're about to use.
Oh, wow. I mean, you mentioned, there's a question here from Ricky Stevens. You mentioned Robert Thomas gives people broccoli juice and broccoli soup. What does this do to help? And are there any foods he should avoid?
Sorry, what does that do for your health?
Yeah.
Well, as I say,
not for your health, to help. Sorry. What would
your
it do
health.
to help?
Right. Broccoli soup and broccoli juice have high levels of indole-3 carbinol. Indole-3 carbinol neutralizes estradiol, and it changes the receptor sites in your cells. So nasty estradiol can't sit on them, because estradiol creates havoc inside cells. So that's what the juice is doing, and so is the soup doing. I think really I ought to just say one more thing that's really, really important about prostate cancer. What I have learned in the last 20 years can be simplified down to one thing. I think there's a major triangle, I call it the Bermuda Triangle, that dominates prostate cancer. And this triangle has in its 3 corners, if you have 3 corners to a triangle, I never know. You have diet, vigorous exercise, and you have fat control. So when people go on juice diets, quite often they're actually on something that's going to reduce their fat anyway. So a lot of my American patients literally go on a juice diet. They go very vegan, and they go on juice diet and so on, and that's bringing their fat down as well. So the green juices, the broccoli juice and so on, if you combine it with other things, will bring your fat down. But this cancer, fat is a major part of this cancer because fat sections in your body lead to more estrogen. So you can see there's a picture emerging here. I'm sorry to have to say I'm more in the estrogen camp than the testosterone camp.
Okay, you told Mark Kittens that kite surfing was excellent for him. Why is that exactly? It just comes from
Okay.
Rudy DeZorno.
Yeah, this is about vigorous exercise. Okay, we have a Cancer Active. We have a large number of people who've beaten their prostate cancer. And I can say that in all honesty. So I have got one younger guy, he's about 38, in the Midlands, and he had it in his bones, he had it in his lymph, and he decided he was going to go to the gym, and he worked out for 2 hours a day, every day for about 6 days a week. And slowly but surely, doing other things in the program, he got it out of his bones and out of his lymph. The hospital told him they'd never seen anything like this before. And they decided, as it was now only in his prostate, they would give him radiotherapy. And I was going, please don't do radiotherapy. But, he did the radiotherapy. He said, look, Chris, I've got 2 children anyway. I'm all right by it. So he did it. And, you then look at other people. I mean, in America, I've got a guy in the national volleyball team who was in the national volleyball team, the seniors team. And regularly in America, they go straight off to the gym and start pumping iron. I'm not saying you should pump iron. What I do think is people should think about doing some more vigorous exercise. We're not talking about strolling through the woods with the dog for a couple of days a week. We're just not talking about that. And so when Mark Gittins lives down on Hayling Island, he said he was going to take up kite surfing. And I said, don't, whatever you do, fall in the sea. Because I used to fly over Southampton water there, and it's just full of, the sewers come out, And so I said, it's too dangerous for you. But, this is the sort of exercise we do. And then he went skiing. He did all those sorts of things. And I remember one day, this is absolutely true story, I was helping a lady, and this man went past in the background. And I said, I know you. And he was about 72. And this was in Liverpool, right? And I said, where are you going? And he said, I'm just going off to play walking football, right? So he was doing walking football 3 times a week. And he was also doing badminton 3 times a week at 72. Great, good on him. That's what's going to beat this. Literally, we know that if you do exercise, you don't just oxygenate your body, you actually reduce the fat in your tissues. It works like something like a torvastatin. It works like a statin. So exercise, vigorous exercise, really good idea for this cancer, more than just sort of walking down the road.
Interesting. John Weatherspoon asks a good question. You touched on this earlier. My doctor told me I had inflammatory prostate cancer. Is that different?
No, it's, as I said earlier on, it's not different. It is called inflammatory prostate cancer. Well, let's talk about the other reason, okay? So estrogen is proven to actually cause inflammation in the prostate. And just as a final point on the estrogen thing, I actually had 3 professors come to me in a week before Christmas a couple of years ago, and one was in Australia, and he worked in a hospital, and it's your best guess why he came to me, but we were talking about the whole estrogen thing, and he went off and checked everything I said. Now, the second thing is infection. You get infection down there. Us chaps, we don't just only get it there, we get infected in our bodies. So I get a lot of men who have been abroad, and whether they got food poisoning or not, they've got a parasite. I get other men who, in the run-up to prostate cancer, started getting UTIs, urinary tract infections, and that can be E. coli. And we know E. coli is a bacterium. It's a player in prostate cancer. But the big area is viruses. And so you can have HPV, you can have herpes. I mean, most men wouldn't know they got HPV. I've actually had 5 patients in Vancouver and Seattle, in the opposite sides of the river up there in top left America, and they've all got HPV-driven throat cancer. They're all in their 70s. And after about 10 minutes of the chat, they go, I've been totally faithful to my wife for 52 years. And I say, I have to explain to them that HPV is like herpes, you get it. You don't know you've got it at the outset. 95, I don't know, % of us just get rid of it because of what we eat and our immune systems are strong. But in other people, it dives into the nerve endings and it only comes out again when your immune system goes down. But we've got cytomegalovirus is a player in this cancer. And we've just had research in showing that shingles, which is varicella, actually, when you get shingles, us older chaps, I haven't had it luckily, but when you get it, the varicella can wake up your herpes virus now that it can come to play. So they're the sorts of things you can have. And if you've got infection in your prostate, you're asking for trouble, really. And the other one is yeast, and yeasts cause this kind of they're not like pathogens. Pathogens, all the viruses and so on, they make toxins, they make mRNA that can change your mRNA for the worse. But yeast just cause areas of low oxygen in the body. They colonize the body. And my theory with prostate cancer is actually us chaps who like a beer and so on, you know, if you've got yellow toenails or anything like that, you would know this. You've got a yeast infection. The yeast go in down there. According to my Australian professor, it's very hard to get drugs and so on it down there. That's maybe why we don't have a lot of drugs for this cancer. But the yeast set up the environment, and then you get a virus, or is it E. coli, or is it a parasite, and that gives you toxins and so on. And that actually probably what tips you over the edge and gives you the cancer. So that's the other way you can get highly inflammatory prostate cancer. If anybody ever comes to me, I deal with the bacteria and so on. We kill it all off and we build a program against the estrogen. We always do.
Well, this question actually links to it from Tony Parks. I've had constant urinary infections and antibiotics don't seem to get rid of them. What can I do?
Well, as Julian Kenyon said on our gut bacteria show, they're giving you the wrong antibiotics. It's impossible for an antibiotic not to work over a period of time. And so they've given you the wrong one. Urinary tract infections are almost always E. coli. Some poor chap did some research. You've got 90 trillion gut bacteria, okay, when you're healthy. And somebody actually did some research, don't ask me how, and they showed that you got a urinary tract infection, male or female, when E. coli went over 1 trillion. And so when you take an antibiotic, this is what happens. The good guys all go down and your E. coli goes down. No one ever said that an antibiotic killed E. coli off. All right, it's supposed to, but it doesn't. So it all comes back out again, which is why this chap's got urinary tract infections again and again. Artemisinin, oregano oil, that would do it. Sweet wormwood, artemisinin.
You make it seem so straightforward. It's you amaze me.
I've been doing it for 20 years.
I know, but you understand. But you know, there are doctors out there who still don't get it.
Yeah.
Right. I've just been diagnosed with prostate cancer, says Roger Collins. A PSA of 4, Gleason of 3+4, and it's contained. I'm being offered radiotherapy or surgery. Do I have any other options?
Loads is the answer to that. It's right. Without being controversial, the way we go about treating people in Britain is that drugs have to be approved by NICE, or treatments have to be approved by NICE. And it's always a cost-effective issue for NICE. And so the two official treatments that are used in Britain are surgery and radiotherapy. Now, I'm sure people would disagree with me, but I wouldn't have surgery. I don't like the idea of the surgery. And anyway, I'll tell you now, only very rarely does the cancer not come back. It's not the end of it. That's my observation. I get a number of people who've come back and got it in their bones and lymph, and they've had the surgery 5 years before. So I don't think it's the end of it. Number 2, radiotherapy. Well, I worry, and I said this to Rob Thomas, for years I've been reading that we're going to have something between the prostate and your rectum, because this radiotherapy beam goes straight through. Okay, and it hits your rectum. And a couple of years ago, I had 3 people, 2 in Australia, who'd actually had rectal cancer as a result of radiotherapy on their prostate. Rob Thomas assures me that they've got a gel that they now squirt in between the prostate and the rectum. So, okay, maybe I'd like a bit of testing done on the gel, please, before I had it. Now, this next bit is a bit weird. There is another treatment, and it's called brachytherapy. And there you put little seeds all the way around the prostate, and these seeds are radioactive. And the half-life is about 1.5 years. And I've had people in Britain and in America, it's all gone away. So as far as I'm concerned, it works. And I don't quite understand, perhaps it's price, why we don't use it as much. Although I did suddenly have a patient who used it or was given it about 1 year ago. So that's brachytherapy. What always makes me laugh is cancer research say brachytherapy is perfectly safe. And then they go, but don't put children or pregnant women on your lap. Okay, so gotta laugh, really. Now, what else is there? There is then ablation. Okay, ablation is the use of heat or cold to kill cancer off. And it's used for kidney cancer, for example, in Britain today. And some hospitals are now starting to use it on lung cancer. But mention ablation and prostate cancer, everybody winces and runs away. So you might have to go to Germany. But what you do, if you've got confined, prostate cancer, Richard, for example, who we both know, he literally went to Clinic St. George and they ablated him. They put a weapon, I don't know what you would call it. It was a bit like a fishing ledger. And they put it inside his prostate and they heat it up and it kills the cancer on both sides. That's ablation. That's really old-fashioned ablation. But you can now get little pens and you come at the tumor with a little very, very hot pen and you almost cauterize it, or put -40-degree gas in there, and that's a cryoablation. But now, of course, the new thing is to come away from the prostate and use HIFU, high intensity focused ultrasound. So it's exactly the same thing. You're using high intensity focused ultrasound to heat the tumors up. Now, we have poor old Mark Emberton, who did lots of research on it at the outset, his own really, he did one clinical trial, then another clinical trial, but never really, I think, has it taken off in Britain. And I fear this is something to do with the numbers of surgeons we've got who run the BMA and so on. I don't know. But I have sent about 20 people to America. I'm serious. There's a guy called John Jarridge, who's always served my patients well. We've used him with American patients and we've used him with British patients. And he's in Louisville, just south of Chicago, I think it is. And when I first came across John Jarridge, there's about 3 top people in America doing it. He had done about 1,500 people there. What's interesting, I know I've got patients who've been and I've talked to them. He doesn't just ablate the tumor, he goes around the outside of the prostate. And when you say, why would he do that? Oh, well, it's to kill the cancer cells that are released when you have a biopsy. Wow, an honest doctor. What's coming to the world? We know when you have a biopsy, you can release cancer cells, but everybody goes, no, you can't, no, you can't. But there's research, 2 studies from guys in about 1994. So, so this is what John Jarridge does. And you have to get a flight out there, and I don't know exactly what he charges, but they're very helpful to all the people I've ever sent there. And he's got pretty well 100% record for impotence. You're not impotent afterwards, and about a 95% record for incontinence. And you literally, he reckons most of it clears up within a year anyway. The only problem is you have to have a tube out of you and lots of antibiotics for about 30 days afterwards, get rid of the muck that you've killed off. But I've got 2 brothers, and the younger of the 2 has had the ablation, the HIFU with Jarridge, and here we are, I think about 4 years on, not a trace. Okay, the final 2 things are the nano knife, where you put a pin in either side of the prostate or the tumor rather, and you pass an electric current across this. This isn't as painful as it sounds, but they were doing it at the Karolinska Institute with ladies with little tumors in their breasts and put a pin either side and put the current across, and it punches nano holes. The electricity punches nano holes in the tumor, which has a great effect because the tumor lyses, so that kills the tumor, but also the leakage prompts the immune system to come out looking for these cells. And if you've got it anywhere else in the body, the immune system mops it up. And I should say that on HIFU and NanoKnife, one of the top surgeons in Sydney has gone down the road to the Gold Coast and set up this big clinic doing NanoKnife and HIFU. There's a place in London called the Focal Therapy Clinic where you can get HIFU, and for NanoKnife, it's very hard to come by in Britain. There's a place in Holland, no, just inside Germany. Vitus Clinic, I think it's called the Vitus Clinic. And the final thing is proton beam therapy, which I think I would have. I've just been written to by one of my patients who said, thank you, Chris, because he got his proton beam therapy in, which was, as he said, the best £30,000 he ever spent. He got it in before Rutherford's went bust. You know, I interviewed Carol Sikora in Britain, and Carol Sikora was behind bringing 3 proton beam centers to Britain. And it's desperately sad because proton beam therapy, I would have every day of the week over radiotherapy. Radiotherapy just goes straight through in a straight line. Proton beam, you set it. It only attacks something 4.5 centimeters away from the nozzle. Doesn't attack anything before or anything afterwards. So it gets rid of my problems about radiotherapy on the prostate. But that's my 2 brothers. One years ago, about 9-10 years ago, had proton beam therapy. And when his little brother got prostate cancer, he sent him to me and we got him HIFU. So then you've got watch and wait, which we like. If you're only 3 to 4, we've got a good chance of actually turning it all around for you.
Amazing.
Is that exhaustive enough?
Yeah, absolutely. There's a question here from Peter Rees, which I find very interesting. My urologist has put me on watch and wait. What can I do to help myself, and what can I take as supplements?
Okay. Right. Watch and wait is the common one. And I'm going to tell you straight up, you mustn't wait. You know, you can watch it if you want, but you mustn't wait. And we would say to you straight away, look, get your exercise going, get your oxygen up to 99%. That's number 1. Number 2, get on vitamin D3 fast. You need to have blood levels of about 125 nanomoles per liter. In America, they tell everybody to be between 100 and 150 if you want to be really, really healthy. And even the American government talks about 80 nanomoles per liter. We don't have a figure in Britain. But vitamin D arms your immune system. You cannot have an attack system from your T cells or your B cells or anything like that, antibodies, without having vitamin D, because it's a hormone. The third area is please watch your sugar and your fat. Okay, now this is very, very important. So as I said, excess sugar makes glutamate, and that's what feeds the cancer. So you mustn't have a blood sugar really ideally above about 4. So fasting blood sugar should be about 4. If you go to your doctor and have a blood test, he will be looking for a figure of 7, because at that level, you're going to get diabetes. But when I spoke with Thomas Seyfried, the ketogenic diet champion of the world, Boston College professor, he has exactly the same figure. That's how they work with the ketogenic diet. They want you to be below 4, and that stops the cancer feeding, according to Thomas. But the big one's fat. Big one, without a doubt, on prostate cancer is fat. And I would say if you were up to 4.5, right, a doctor is looking for a figure of 6 with your cholesterol level, because at 6, you're going to get a heart attack or a stroke. So he's looking for a figure of 6. Again, we want you to be below 4. Triglycerides about 0.8. And what you're seeing there then is we are actually reducing the fat in your tissues as well. So what actually happens is cancer feeds on sugar or glutamate, and when it goes to spread, which is the last thing you want, it actually starts to burn fat. So it goes into the lymph system and burns fat. So that's all cancers, not just prostate cancer. So we want you to have low fats. So we use, if you're below 4.5, we use lycopene. Lycopene is tomatoes and cooked tomatoes. Lycopene reduces your fat. It's got research showing it reduces the risk of aggressive and fatal cancer. Well, that sounds pretty good to me. It also kills E. coli. It also blocks glutamine becoming glutamate, and it also kills cancer stem cells. So lycopene's huge. Okay, and we use lycopene. But, you know, frankly, I had an Irish chap the other week and his cholesterol was 9.8. There's no answer for that apart from atorvastatin. And if you're going to take atorvastatin, for goodness sake, take coenzyme Q10, because atorvastatin lowers coenzyme Q10 in your muscles and in other parts of the body. And we know low coenzyme Q10 is linked to more cancer. And if you've got cancer and low Q10, it spreads. So that would be the background. That would be the little bit of background. But what I would say is this. We know a lot about what supplements work. And it's a different bunch of supplements. Again, it's a different cancer. It's a different bunch of supplements. So we'll start with lycopene. We often, if someone's got high fat, we would use lycopene and atorvastatin. But let's start with lycopene. So we have research, as I said, lycopene restricts aggressive and fatal prostate cancer. And then there was research about 10 years ago saying if you took turmeric with it, that made it work even better. And lycopene and turmeric are both compounds that need a bit of fat. When you take your pills, you need a bit of oil or a bit of fat. They need to get across the gut wall, and they can't do it. They're big molecules. And piperine, black pepper, is really good to take with both of them. And then about 9 years ago, we're on a countdown, there was research in animals which had all been given prostate cancer, and they found that holy basil, which is the #1 Ayurvedic herb, Tulsi, holy basil actually used with either turmeric or resveratrol, that could kill prostate cancer cells in situ, in the animal. So this is really useful. Now, what is the active ingredient in Tulsi? Well, Tulsi's got lots of active ingredients, but the big one for prostate cancer is something called ursolic acid, ursolic acid. And when I went checking it out, actually, where else is ursolic acid? In pistachio nuts. And we all know pistachio nuts are really good for people who want to sort of beat or prevent prostate cancer. So that's a bit too much of a coincidence. And then we know that there's we know that resveratrol is the other thing, turmeric or resveratrol. And the problem with resveratrol, with holy basil, is resveratrol, doesn't matter which research study you look at, is somewhere between 40 and 100. We actually, milligrams, we use high dose resveratrol. We use 500 to 750. And I'll come to tell you why, but we use high doses of resveratrol. And next thing is pomegranate. There's very good research on pomegranate. And Rob Thomas, a long time ago, came down to the Groucho Club and we had a glass of wine, talking about his broccoli juice and his tomatoes and his exercise, and putting off the need for men at Addenbrooke's to have surgery by 4 years. And they'd made him do some research. And over the glass of wine, we were talking about pomegranate and turmeric and EGCG. EGC is another one. And that's how we got to, or he got to pommy tea. So EGCG was in green tea. EGC collects down there. Zinc collects down there. But for men, you must have some, but you mustn't take too much. So we use like 25 milligrams 3 or 4 times a week. So you've got a little picture building up of a lot of things here, and it is a lot of things. And I've told you already, we would also use black cumin seed oil if you weren't having any treatment, if you were just watching and waiting, because that sorts you out completely in terms of your estrogen and your testosterone. So they're the things we would do. Now, how do all these things work? Well, would you believe all of them are polyphenols? So they all attack cancer stem cells. Resveratrol, turmeric, lycopene, EGCG, they all pomegranate, they all attack cancer stem cells, and they all block glutaminase. So no wonder they all work. They're doing the 2 big jobs. They're stopping the formation of glutamate and they're attacking cancer stem cells. And so we would use a bit of zinc as well, as I said. Now, in America, there's another thing that is very popular. It's called IP6, and it comes from bran. So it's inositol hexaphosphate. And there's research, 20 years of research on prostate cancer. It robs cancer cells of their iron. So it does a completely different job to everything I've been talking about. And so it robs cancer cells of their iron and stops them feeding and basically stops them going anywhere and doing anything. So it kills them. And you take 800 milligrams between meals 2 or 3 times a day. So my American patients who come to me do almost the same, but the ones that I get people who come to me who've been, had their cancer held for 6 or 8 years, and they do neat arsolic acid. Okay, I think you can get it on the web. They do IP6, they do vigorous exercise and lots of weight training, because weight training puts up your testosterone. And they use fenbendazole, an off-label drug, but we won't talk about that. We've got another show on off-label drugs.
Unbelievable.
Lots.
Information. Right. Julian Fender asked the question: my prostate cancer has spread to the pelvis. They're suggesting radiotherapy and/or 6 rounds of docetaxel. What do you think about that?
Well, this is when the normal orthodox medicine comes out. So you can have radiotherapy, which blasts the tumor, and it works. And you can have 6 rounds of docetaxel, but that will, one of the things we do is we always rebuild your gut, and docetaxel will put that down. So it kind of is working against it and almost putting you back to where you were. But we have a program on the site. I've done it in other shows, which says that it's called 10 ways to improve your chemo and reduce your side effects. And I had a chap up in Essex who did the program around his docetaxel. So it's not black and white, is what I'm really saying. It's not like, do I do the chemo, which is, can be bad for me, or don't I do it, and do I do something else? We can actually build you a program around your chemo and actually make it work better and reduce your side effects. So there's a sort of middle ground as far as I'm concerned. And we had a guy, and I don't remember, he came to the show about 6-7 years ago, and he was so pleased because I built his program for him. His tumors in his bones and lymph had gone just by using the little program on the outside. So we can, you've got to do things to protect yourself. Yes, I would use radiotherapy, hyperbaric oxygen, berberine, melatonin, turmeric. Yes, I might use chemo, but just do what we've got on our website, or come and talk to me.
I remember him and how glad he was. I can remember his face.
His wife, and he would stood up and just said, well, thank you. It's all gone.
Last 2 questions. Do you have any tips about depression? This is not me, by the way, this is Stanley Robinson. I'm so depressed all the time. According to my wife, I'm so depressed all the time, according to my wife. I'm on bicalutamide.
Right.
And this is not normal for me.
It's a well-known fact that when you reduce men's testosterone, they get more depressed. So it's not just the cancer. It actually is something physical inside you. So it's not psychological only, it's psychological and physical. And there is a warning with the new breed of testosterone reducers, because they don't leave you with 5 or 10%, they take it all away. And the warning, it's really interesting this, because the warning was actually, I took it, it's on our website, but it was actually a sheet for doctors saying, please watch out for this in patients. And I have a guy with chronic depression in, I won't say where in Britain, but in the West Country, let's leave it at that. And he's got terrible depression. And I always tell the wives, I quite often get the wife with the husband, and I always say, look, for goodness sake, watch over him, because believe it or not, men who get depression go and top themselves. And there's quite a high incidence of it. So depression is caused by hormonal changes. It's also caused by gut bacteria making or not making serotonin and things like this. I'm not an expert on depression, but this was a warning sheet for doctors. And she'd gone and told her doctor he's got depression, and the doctor said, what do you think I'm supposed to do about it? I'm serious. So please go get your wife to talk to the doctor, and don't accept a kind of shrug.
I'm not saying they're connected, but my own granddaughter, Caitlin, is her first month as a police officer, and in her first 2 weeks had 10 corpses, of which 7 were suicides.
Yeah.
That's in Amersham, which is, like, let's be fair, is a nice place to live, nice part of the country. Terrible.
Yeah, I know.
Terrible.
It's not a special subject of mine. I just see my role as warning people. But
Yeah.
Excuse my French, but it does piss me off, because we get a lot of this all the time. So we know, for example, grapefruit juice, large oranges cause aromatization, but we also know they clash with a load of drugs. They clash with statins, and they clash with some chemos and things like this. Doctors are the first people to say, oh no, don't take any supplements when you're using my drugs, but they never tell people that. And when the grapefruit juice and the oranges can actually, it's got something in there, CYP something or other, and it actually can make the drugs less effective, but it can actually multiply them up. So you can end up, I had some poor lady in America ages ago who literally every hair had dropped out of her head, and she'd lost all her nails, and she was on Taxol. And when I said to her, I don't understand why, what do you have? Tell me your diet. She said, oh, I have a large grapefruit for breakfast. I love my grapefruit. I went, that's it. There it was on the front page of Taxol, but she'd been told not to take any supplements, but she'd not been warned about grapefruit. I will, as one other thing I would say that's really quite important for men. This cancer is also driven by something called phosphatidylcholine. And phosphatidylcholine is sort of something on the pathway to driving the cancer. And choline is a real problem. So when I build people's diet, yes, we use a rainbow diet and so on, you must not eat high choline foods. High choline foods are steak, mass market steak. They're bacon, salamis, hams. They're mass market eggs, and chicken fat is the other big one. So don't touch choline. Also check your B vitamins. If you can take B vitamins, men, a lot of B complexes, is that the plural? Complexes? Complexes. A lot of them actually contain choline. Don't take it.
Wow.
Research from Harvard. Erin somebody or other, professor. Can't remember.
Last question.
Go on then.
This is from Peter Desaurus. What three tips do you have for people newly diagnosed with prostate cancer?
That's a really good question. I hadn't thought about that. Do the basics, get your oxygen up, get your vitamin D up, fix your gut, just do the basics, get on the right diet. Secondly, I'm really sorry, take up vigorous exercise. You've got to, and you've got to go and find out your basics, your oxygen, your vitamin D, but also your blood sugar, but most importantly, your blood fat. You've got to find out your blood fat levels, and you've got to bring them down with lycopene and or something like atorvastatin. That's where I would be. If you're newly diagnosed, that's where I would be. What I should have said at the other extreme, that chap who's got it in his bone, there are 2 other treatments if you're not newly diagnosed, if you're the opposite. One is lutetium-177 and the other one's radium-233. And these are seek and find isotopes and you can have in your body, but and we'll leave that to one side. But there are other things you can do. It's all on the website. We do it all in PPs when people come to me. So that's what I would do. I would do the basics. I would get my fat down, and I would make sure, and I'd rebuild my gut. But I'm afraid this is all about diet, exercise, and fat control, like I said at the start. And supplements are a really big part of this cancer. I probably use more supplements on this cancer than I do almost any other cancer.
Right. Chris, I've got to say, you know, we've been mates for a long, long time. I've watched you learn and learn and research and research. I've listened to a lot of Sunday shows, but there's never a minute wasted. And on behalf of a lot of people, I say thank you. Cheers.
All right. Well, thank you it's a pleasure. I'm trying to do about 15 of these, and I've actually done one on brain tumors as well. I just want to do about 15 of these and sort of put it down for my legacy. Then I can retire, can't I?
That'll be the day.
That'll be the day. Yes, I'm going to take up football then. All right. Walking football, probably. All right. Well, look, thank you, Larry. Thank you, everybody, for watching this. And I'll see you soon with another show about another subject on cancer. Okay. I hope people got a lot of tips and information out of it. Bye.
Cheerio.